Hi, good afternoon everyone. My name is Chia, I'm your MC for today. With us today is Dr. Chan Choon Teng from Oasis Eye Specialist Johor Bahru. So she will be presenting on the importance of periodic retinal screening in patients with diabetes to us today. So this will be her sharing session topic. So let us invite her to introduce herself and also to dive in further in the topic. Without further delay, let us invite Dr. Chan.
Hi, Joanne. Good morning. Good afternoon, everyone. I'm Dr. Chan Choon Teng from Oasis Eye Specialist. Today, I'm very thankful that the organizer giving me an opportunity to talk about diabetic retinopathy. Right. Okay. Actually, from the National Malaysia Healthcare Survey in 2019, showed that actually 1 in 5 of our population had diabetic. So it's actually in total about 3.9 million people having diabetic in Malaysia. And the rate is increasing alarmingly. From 2011, it was actually 11%. 2019, it became 18.9%. And almost half of them actually doesn't really know that they are diabetic until that they had done the screening. Yeah, this is actually a slide to show the risk of getting diabetic retinopathy. So both type 1 and also type 2 diabetic patients will get diabetic retinopathy. In 5 years' time, type 1 diabetic retinopathy can be found in 5% of a patient, and also in type 2 diabetic, about 35%. Whereas in 10 year time, the rate had increased to 75% for type 1 diabetic and 55% to type 2 diabetic. Okay, how this diabetic retinopathy actually occur, and what had the diabetic mellitus had caused changes in our body. Mainly is because of they change our blood vessel in our whole body, including the eye. So when you have diabetic for a long time, it actually can make your blood vessel wall become thinner, and your blood vessel wall can easily get out bulging. Then we call it as a microaneurysm. And also it can be thinned out to the extent that some exudate coming out from your blood itself. And over the time, your retina doesn't really get enough oxygen and nutrient from the blood vessel, so they will react by promoting and releasing the what we call as vascular endothelial growth factor. This growth factor encourage those unhealthy and abnormal new vessel to grow, and this new vessel is actually not really giving oxygen or even nutrient. It can burst easily and causing bleeding inside our eye.
So Dr. Chan, if there is bleeding in our eye, will it affect our vision? What will the patient see?
Okay, actually to see what is the extent of the diabetic retinopathy. So when early stage, you only have these dot blood hemorrhages and very little at the periphery part of the retina. You basically don't have any symptom.
So if at the side is not obvious lah.
Yes.
But if it's like central of the vision, then they will see like patchy vision, is it?
Yes, correct. Yeah, some even like sudden loss of vision, and I will talk about that further in a later slide. Right.
I also read somewhere that diabetes is one of the main cause of blindness in Malaysia.
Yes. Actually, we have a lot of diabetic patients in our population.
I saw in the newspaper we are like the ASEAN champion for diabetes.
Yes, I think mainly we
that
have a very nice and good food and delicious food.
Champion.
Yeah, and our food, a lot of high carbohydrate and sugar. Right. Okay. Okay, this is just to show you our normal fundus retina. The main you have a pointer. Oh no, okay. So the main nerve is optic nerve is actually connected to our brain, and the central part over here, basically this area is what we call as a macula. So macula is our central part of our retina. The other part, we just call it as a retina. Why I especially highlight this area, because macula is the most important area for us to really get able to see
sharpest
clearly.
Point of vision.
Yes. So if diabetic maculopathy happens, meaning diabetic changes just happen at the macula, a lot of time you can pick up very early because you suddenly have blur vision or distorted image. But if it happens other part of your retina, then yes, sometimes you don't even know that you have all this blood inside your eye unless you do the screening. So this photo at your left side is actually just to show you the diabetic retinopathy only happens at outside the macula, meaning other part of retina other than the macula. And a lot of time in this kind of case, you don't have any symptoms.
Yeah, we actually caught one patient here who had retinopathy. There's dot blood hemorrhages in the side, and he's not aware of it.
Yeah, until you really screen it,
so
right?
we just tell him, he's not aware he has diabetes, so we just tell him you have retinopathy, maybe go and check your blood and
you see,
control.
About 50% of them, they don't know even they have diabetic.
They have no idea they have diabetes, but then we catch them with bleeding in the eye.
And the next one will be diabetic maculopathy. Like I told you just now, the center part of your retina having all these blood clot and also yellowish exudate. This is mean that they have a maculopathy. A lot of time when they have this, they will have some form of vision disturbance.
Loss.
Okay. The next one. This photo is just show you that they have diabetic retinopathy at the same time maculopathy. So usually in that stage it's quite bad already. You will be in a proliferative stage of diabetic retinopathy. So about staging for diabetic retinopathy, in overall we actually divided it into a proliferative and non-proliferative stage. Okay, non-proliferative meaning is like mild, moderate, and severe, and a lot of time is no symptom. Okay. Whereas when it comes to a proliferative stage, it's more advanced already. They will have symptoms, and of course we have to see how severe is the condition, and we need to give treatment immediately. Okay. So this again, this photo just to show you a patient having a mild and moderate diabetic retinopathy, and a lot of time, like I said, no symptoms. We only detect all this blood. Dot like Joanne shared just now, during screening they found to have all these, and very sorry to say that at that stage usually we just advise patient, please take care of your diabetic. We can't do much for that, but we hope that when you control your systemic diabetic, then your whole condition will get improved, and we will monitor them every 6 monthly. So when they come to like severe diabetic retinopathy, or we call as a pre-proliferative type of retinopathy, when we do screening, we see, the blood vessel getting bigger compared to the normal people, and more and dot blood clot, and at the same time they also will have what we call as a cotton wool spot. This cotton wool spot is a white dot that you can see from the picture. Yes, that is the one. Yep. It actually means that your nerve fiber layer start to die off. So it shows, not getting enough oxygen and nutrient from your blood vessel. So at that time, again, we can't do much still. We will still like just please bet them. Please take care of your diabetic, and we will see closer every 3 to 4 monthly. Yeah. So this is a bit late stage already, become a proliferative stage, and you start to see a new vessel forming. So this new vessel is very scary looking. A lot of times some of the patients will start to experience, the vision not as clear as normal time. But this one, we can't just leave it like that. We need to do something. Either you want to do intravitreal injection of anti-VEGF agent, or we need to do a laser pan-retinal photocoagulation. I will discuss this later on my later slide regarding the treatment mode. And this picture actually shows that the blood vessel is just like new blood vessel. It's just like a boom. It's burst now, and the whole vitreous cavity is full of blood. Then patient will experience sudden blurred vision, and some initially they may just see floaters, that means a red dot flying inside the eye. Then they were like thinking, is this a normal floaters or is there something else? But those very alert patients, they actually can tell, the color is different. It's like different from normal floaters. The normal floaters usually like hair light or is mosquito light, but for floaters, caused by the vitreous hemorrhage, sometimes it can be a reddish color. So they can say, hey, I know this is something abnormal.
I think they may see something like meteor rain also.
Yeah, that is
Yeah,
very
instead
bad.
of normal floater floating around, it's like Liu Xing Yu,
Liu Xing
meteor
Yu,
rain
yeah.
coming down.
Yeah, so in that case, we cannot leave it. We really need to do something. Again, this is either we do an intravitreal anti-VEGF injection, or we may even need to perform a vitrectomy surgery to clear off the blood clot. This is very late stage advanced diabetic eye disease.
A lot of scarring already.
Yeah, a lot of diabetic and scar. And the whitish that area that you see is actually scar tissue pulling on the retina. So the whole retina is detached from the underlying cells. At that condition is very poor prognosis. Surgery, yes, we can perform surgery, but a lot of time it's just to maintain the whatever vision that left. A lot of time it can't be recovered fully. This is a diabetic maculopathy. It's not under any staging of the diabetic retinopathy because the treatment itself is a totally different entity. For maculopathy, a lot of time, what we call slightly better is because they can be detected earlier because usually patients will have some symptom. So when they have symptom like distorted image, whatever they see get skew, or or they see black patch at the center if the exudate is so much. So for that kind, we actually can give an intravitreal injection for anti-VEGF therapy, but of course it needs multiple time of injection. This is just to talk about the intravitreal injection. Most of the time nowadays we actually do a lot of this antivascular endothelial growth factor injection. What these medicines do is it's an antibody. It will bind with the one that the mediator release from the hypoxic retina cell. Like they don't get enough oxygen, they will release something. This agent will go and bind it. So no VEGF like promote the unhealthy abnormal new vessel to grow, and it also can help in stop the leakage from the blood vessel. Then if you have maculopathy, then it will reduce the swelling as well. And usually it's quite a simple procedure, and we can do it as an outpatient. Just inject about 0.05 ml very small agent into the eye. Laser pen retinal photocoagulation. This laser been in the market more than 40 years. Everyone talk about laser, and then they either do a cataract laser or this retinal laser. So this laser, the main purpose also is not really shooting the new vessel, not the abnormal vessel. We actually try to reduce the demand.
The demand for oxygen.
Yeah,
right?
demands on oxygen. So hopefully, I'm praying that the new vessel can just regress after that. And of course, it still need multiple treatment. Vitrectomy surgery is to remove the blood clot from our vitreous cavity, or for those that are having a tractional retinal detachment. So they peel off the scar tissue. Hopefully, the retina can go back to normal, and it only can be done in an operation theater and performed by a vitreal retina surgeon. This one is very late stage of diabetic retinopathy. Patient actually have a glaucoma already, what we call a rubeotic glaucoma. You can see all this blood clot inside your eye. This is actually not only you can't see, but at the same time painful. So some people may even need to go to evisceration. That means to remove the eyeball just to reduce the pain. This is also a very bad retina, that you have a lot of scar tissue. You can't even tell which one is a normal retina or which one is scar. So usually in that case, it's inoperable. You can't do anything, So don't leave your diabetic retinopathy to that extent. Only you want to start to take care. Now this slide actually just to tell you about the risk factor of diabetic retinopathy. Like I showed in the first two slides, the longer you have diabetic mellitus, the higher risk that you get diabetic retinopathy. So of course, for those with a poor control sugar, yes, worse. Then they will get earlier. And if you have a concurrent medical problem like hypertension, you know, have a kidney problem, or even high cholesterol in your body, you have to optimize it. If not, it's just like adik beradik lah. They will come together, you know. So healthy lifestyle, yes, important. Please quit smoking. Try to control your weight by doing exercise regularly, because all this is also come together, will increase what we call insulin resistance. So your diabetes also won't get better control with obesity. Pregnancy, okay. For those like just diagnosed pregnancy to have diabetic, gestational diabetic, yes, that one maybe not necessarily need a screening, but for those mommy who is known to have diabetic and get pregnant now, then yes, they no try. They have need to do screening because they sometimes can get diabetic retinopathy very early. Okay, this is timing for screening. Okay, for me, I personally will advise those like type 2 diabetic, please get a baseline screening of your diabetic. Once you get diabetic, you need to screen your eye. Just to, like you say, just to check. Sometimes you don't even know. Sometimes you don't know you're diabetic until you get your screening done. And if you have no diabetic, yes, if you don't have diabetic retinopathy, then you can just do a yearly checkup. If you have mild form, 9 monthly, moderate, maybe 6 monthly, and if it's severe, 3 monthly. Of course, when it comes to proliferative, you can't be just like 6 monthly. Sometimes you can need like every week to do the checking. Why? Because if you want to do a laser pan retinal photocoagulation, it will be a weekly treatment. So you come back every week. If you need injection, every month. Right. Okay, what we do and what are the methods of eye screening? Actually, I see you have quite a numbers of machine around, right?
We have a retinal camera, and we also have a retinal interpretation artificial intelligence.
Okay,
so we have two actually for diabetic lah.
And then that one is very good. Then you don't really need AI can help us do a lot of things. The screening.
So normally we will scan with the normal retinal camera. Then if we see anything abnormal, not necessarily diabetes, diabetic retinopathy, can be other retinal problem, then we will use the AI to confirm.
Which center of your focus point is actually having all these machine that
at the moment we have 13 outlets, but we have committed to roll out to all our advanced primary eye care outlets. That will be more than 70.
Okay.
So we will roll out in a span of 6 months. So expected by next March, we will have all our APEC outlets, which is the routine that we are promoting now, to have the AI machine.
Yeah, please, really thank you that you guys involved.
So it will be very effective in catching all these conditions, especially for diabetic retinopathy.
Do you mind to share which branch in Johor Bahru itself that actually provide this service?
At the moment, Concept Store South Key has it, the one on ground floor.
All right.
That's the first outlet in JB to have it. We will roll out in outlets like Bukit Indah, Aeon Tebrau, Bukit Indah, Aeon Tebrau.
Eventually we'll have more and more.
Kulai, Johor Premium Outlet.
Johor Premium Outlet also.
Yeah, so 5 to 6 outlets.
Yeah. So actually, of course, in all the eye clinic, we'll do all the screening, but we also very helpful.
Because we are first in line, we normally see the not knowing patient first. So if we catch it, then at least we can catch it and send it to the doctor in time.
Yeah, correct.
Yeah,
right.
They don't like go to see the doctor. Like if they are normal, they don't see the doctor.
This is actually the main problem in Malaysia. A lot of time they don't really know that they need to see doctor.
So normally they come to the optical shop first.
Yes.
So we can catch them in that time. It will be good lah. So that's why we are upgrading our services.
Right. Okay, so when we do screening, we actually do visual acuity just to check how good you can see. And we also do a slit lamp examination, meaning we put eye drop in your eye to dilate your fundus, and then to dilate your pupil, then we can see your fundus whether you have the diabetic retinopathy or not. This is a fundus camera. I think we have that in
we have the
in our
screening
event.
here. We will be here till tomorrow.
So this fundus camera also can help to try to detect the diabetic retinopathy. And what is optical coherent tomography? Basically, this is mainly more to diabetic maculopathy. So diabetic maculopathy, you will have a swelling. So this using infrared technology. So it will capture every layer of your retina just to see which area is having swelling. And we give injection for this maculopathy, and then we want to see response. Again, we will do this optical coherent tomography to see your response. Okay, so prevention always better than cure lah. So you better have a good blood sugar control, high blood control, and also your cholesterol control. If you are advised to do eye screening, please do so and follow the screening schedule.
I'm actually a diabetic as well.
Oh.
My doctor always look at HbA1c level.
Yep.
Is that more accurate than this normal blood
Okay.
sugar level?
Okay, you see, HbA1c, most of the time you need to go through lab to do that. So you can't really self-monitor at home. So this is just a way for you to self-monitor at home. So you roughly know, rather than you go for HbA1c, you can't be doing the lab test every day or every month, you know. Of course, HbA1c is to see in overall with 2 to 3 months time how is your blood sugar control. But this is just a regular daytime. You just let you know, how is your blood sugar control? If it's really high, you know, this food can cause your sugar to spike up, then you don't eat it so frequent. And high blood also, you can do self-monitoring at home. Of course, performing healthy lifestyle is very important lah. Oh yeah.
I think nowadays people are too busy to exercise.
Yeah.
Don't have time.
Yeah, that's why sometimes don't have time, and you know we don't really access it easily. We go to a gym center lah. We have to particularly go out somewhere just to do the exercise. It will take some time. So this is just a guideline, a regular guideline, just to tell you if you're more than 6.1, you most likely is pre-diabetic already in a non-fasting. 7-Eleven, nothing to do with me. It's not my company. I just want to for you to easy to remember. 7-Eleven is just a gross rule. If your fasting blood sugar is more than 7, you may be having diabetic. Or your after eating after meal, then you get 11 or more, then you may be also diabetic. This is the HbA1c that you say just now. You want the HbA1c less than 6.5, more than 6.5, yeah, you probably have diabetic. The main issue in Malaysia, yes, we have so many diabetic patients. The prevalence is increasing every day. And worst of all is a high number of them actually go undiagnosed. And even for those diagnosed, they don't really know how to really take care of diabetes.
Education is very important.
Yeah.
Everyone plays a role.
Yeah, I think this is why we are here today, just to let people understand the importance of diabetic patient to do the eye screening. Yeah. So yeah, this is my personal encounter. Like, you know, what is the main problem that we face when we want to see patient with a diabetic retinopathy. Mainly, patient don't really know that they need to check their eye. They don't know that when the diabetic go into the eye, they can cause blindness. So they won't go for screening by
Lack
themselves.
of awareness.
Yeah, lack of awareness and education, about that. And a lot of time our diabetic patients, they been treated in a primary care. So that means healthcare service, not every government healthcare service or even private healthcare service having fundus camera, and they don't have the trained healthcare worker to do all the screening as well. And a lot of time in hospital base, yes, the ophthalmologist like us will do the screening, but we will also depends on our colleagues to refer them to us, and we actually reaching out very small numbers of them, because a lot of time they come in, they have other diabetic complication, like they have also kidney problem, infection in other part of your body, then they refer for eye screening, and a lot of time the eye actually get affected, and they can even go to proliferative stage already, that we can't wait, we have to do something immediately.
It would be good if the clinic that's actually reviewing them have the fundus camera.
Yeah, actually
Then
not all
it
the
would be
clinic.
good.
Yeah.
I spoke to a fundus camera supplier. They're trying to sell into the local clinics, but it's not picking up as good as they expect it to be lah. If that could happen, then it will be more effective in screening diabetics. Yeah.
This you need a very big plan, national plan for all the clinic to
That's
get.
why
all this.
we also hope that one day we can have all our outlets to have a retinal camera, but at the moment we have about half lah.
Okay, I hope next year maybe all, right?
Hopefully.
Right. Okay. So in summary, prevention is always better than cure, and I advise to do a regular eye checkup, early detection, and also effective risk factor management actually can reduce the diabetic complication, including the eye. Right. Okay. Thank you.
So thank you, Dr. Chan, for a very insightful session. So as we heard just now, if you have diabetes, you actually need a regular fundus examination, even if you don't have a retinopathy, at least once a year. So do come to Focus Point Advanced Primary Eye Care stores to get your retinal screening annually. It is free of charge at the moment. So do grab this golden opportunity to get your comprehensive eye check. Thank you very much.
Thank you, Joanne. Thanks.